Hello, I'm Dr. Marilena Alvarez, and today I will present a brief educational video on heat strokes. This is a medical emergency from which many pets do not recover. Heat strokes occur commonly to dogs who live in hot, humid climates, such as my patients do. It's a condition that occurs when the core body temperature is very much above the normal body temperature. The normal body temperature for a dog is between 100 and 102.5 degrees Fahrenheit. If the temperature rises above 105 degrees Fahrenheit, all cells start dying and all body systems can start failing rapidly. Mammals have mechanisms that work to maintain the normal body temperature. Heat is eliminated from the body by evaporating moisture, and this is efficiently done in humans by sweating. Humans have sweat glands distributed over most of their body surface. However, dogs only have sweat glands on their nose and on their foot pads. Therefore, they cannot rely on sweating to cool themselves, and instead they must cool down by panting. If a pet is in a hot, humid area, it will acquire heat faster than it can eliminate it, leading to a heat stroke. The clinical signs of a heat stroke include heavy panting, thick, ropey saliva hanging from the tongue and mouth, weakness, dark red colored gums, staggering, collapse, coma, and death. If you suspect that your pet is having a heat stroke, realize that this is a true emergency that necessitates rapid action. If you expedite cooling, you might be able to prevent permanent organ damage and death. Immediately start cooling your pet by taking the following steps. Take the pet out of the hot place it is in. If you are out on a walk, stop. Do not make your pet continue to walk. Find shade and allow them to lay down. If it is a little dog and you are not far from home, carry the dog. If you are too far from home or the pet is heavy and you can't carry the pet, call someone to pick you up in a car with their AC on high. Wet the patient with room temperature water. Do not use ice or ice water. Do not try to make a patient that is having a heat stroke drink water because that can lead to aspiration. Take the rectal temperature and stop the cooling measures once the temperature reaches 103 degrees Fahrenheit. Next, take your pet to the veterinarian right away, who will continue with the treatment. Cooling the pet is the beginning of the treatment, but it is not all the patient needs, nor is the patient out of danger once the temperature has been normalized. Most patients will require intensive care for several days. In the animal hospital, the patient will be placed on intravenous fluids, while closely being monitored for the serious post-complications which commonly include blood clots, kidney failure, brain swelling, and intestinal wall sloughing, which is evidenced by bloody or tarry stools or frank blood from the rectum. The best thing to do is to avoid a heat stroke in the first place, and this can be done by taking needed precautions. Be aware of what type of dog you have. Any dog can have a heat stroke, but some dogs are in more imminent danger, such as obese dogs, dogs with a thick, dense hair coat, dogs with a heart condition or with any airway compromise, and certain breeds are predisposed, which would include the short-nosed or brachycephalic breeds such as the pug or the English bulldog. Never ever leave your dog in a car, not even for a few minutes, not even with the windows rolled down. Instead, leave your dog at home. Don't leave your dog chained up in the sun. Don't leave your dog in a yard that does not have a shaded, ventilated area. Don't take your dog for a walk when the sun is out. The sun is brutal in Miami. If you are out for a walk and you think it is hot, but not that hot, remember that they are covered in fur and they do not sweat like we do. They can overheat much faster than we can. Okay, that's all on heat strokes for now. If you have any questions, please call us at Country Walk Animal Hospital. Thank you and have a great day.